Good afternoon, everyone. Maybe Elise to stop sharing there. My name is Jonathan Derham. I work with the Environmental Protection Agency. It's my absolute pleasure to welcome you here to this joint EPA HSE seminar, looking at the outputs of some recent very interesting and positive collaborative research that was funded by the HSE and EPA. Some ground rules first, if I may, folks. In the good old days, we used to ask you to mute your phones. We're now asking you to mute yourselves, dogs, washing machines, and anything else you might have on in the background. So please try keep your microphones down and no video, because some people will have not so good broadband. So with your video off, it helps for them to engage comfortably. Some of you may have the option to raise a hand when it comes to the question time towards the end of this workshop. And you can do that with your electronic hand up facility. If you haven't got that, if you use the chat facility to ask your question, then I will put it to the speakers at the Q&A part at the end of the speaking sessions. And we are recording, just to remind you of that, and that's just for the purposes of further dissemination of this knowledge through universities and HSE staff and elsewhere. And without further ado then, what I'd like to do is introduce the Director General of the EPA, Laura Burke, for her introduction. Thank you very much.
Thank you very much, Jonathan, and good afternoon, everybody. And I'm absolutely delighted to be here with you, albeit virtually. In other years, we would have been sitting down, having coffee and sharing insights and experiences, but let's do it the best way we can for this year. And it's really important to have today's event, as now more than ever, I think there's a need to recognise the inextricable link between environment and health. I think we have a gut instinct, all of us, that green and blue spaces are good for both our physical and our mental health. But of course, this needs to be grounded in good research. And research has an important role to play in establishing how human health can be enhanced by a healthy environment. And understanding the interconnections between environmental opportunities, threats, and human health and well-being is vital and fundamental to developing good environmental and public health policy. Therefore, of course, I should extend my congratulations to the research team in Maynooth University, Galway University, University College Dublin, and to the ESRI on the completion of this excellent and groundbreaking body of work. Of course, I'd also like to thank Stephanie and her colleagues in HSE for supporting and engaging in this important research over the years. There is a really close collaboration between the work of the EPA and the HSE in relation to safeguarding the health of our citizens. Of course, I think as we all accept, our environment provides us with food, safe water, clean air to breathe, places in which to enjoy healthy lives, as well as medicines, treatments, and well-being solutions. Our economy and how we live also impacts our health and well-being through harmful emissions, waste, dangerous substances, unsustainable consumption, and overall damage to our natural environment. So protection of our environment is not to be considered merely as an ambition driven by altruism, as it is essential to providing services for our well-being and that of the economy. So it's not just a nice to have. And of course, while government policy can achieve aspects of environmental safeguarding and protection, active engagement and participation by Irish citizens is essential if real and meaningful change is to happen. It's really heartening to see that the results of a public attitudes on the environment poll that was undertaken by the EPA earlier this year show that 87% of adults in Ireland recognise the importance of the environment as an asset to the country. The pandemic of 2020 has also awakened a strong appreciation of our connection to our local environment, with many examples of young and old re-engaging with their local green and blue spaces. enhancing their appreciation for nature and benefiting from access to it. And I think we've all been in the situation where we've got to know our local 2 kilometre or local 5 kilometre an awful lot better during this year. And of course, in Ireland, we're different in that we're very fortunate that we have an abundance of parks, forests, communal gardens and meadows, as well as rivers, lakes, canals and coastlines. Protecting and enhancing these spaces, including green infrastructure in urban areas, delivers a really wide range of health benefits. Green infrastructure and vegetation, for example, can help to reduce air pollution, can attenuate noise, reduce flood risk, and act as hubs to strengthen community interaction and social cohesion. So they really are really important. Providing health promoting environments is an essential requirement for healthy, thriving and inclusive communities. And an investment in accessible and protected green and blue spaces is therefore an investment in public health. In addition to the projects that we'll all hear about today, and I think we all look forward to hearing about today, the EPA and the HSE are also collaborating on a range of research issues dealing with linkages between health and air quality, also on noise, as well as antimicrobial resistance. The research value has the research has a combined value of well over €1 million, and we hope to be able to bring you the results of that research in the coming 12 months to 24 months. So there's lots more going on in this space, and it is an area that the EPA has been keen to develop over the last number of years. So lastly, can I take the opportunity to invite you all to the EPA, HSE, ESRI Environment, Health and Wellbeing Conference, so a bit of a mouthful, but that's going to be co-hosted by myself, Stephanie and Alan Barrett of the ESRI, and it takes place on the morning of the 26th of November. This again is going to be a virtual event, but an interesting lineup of national and international speakers addressing evolving and emerging environmental risks for health and wellbeing. And that event also will have a special session on antimicrobial resistance. And of course, we're going to circulate the invite to the event in November to all of those attending here today. So really that's it from me. I just look forward to hearing the outputs of the research. It's great that we've been able to, I suppose, first of all, fund the research and secondly, hear all about it. I look forward to this afternoon. Thank you very much.
Thank you, Laura. Appreciate that. And Stephanie, may I call on you, please, to introduce. Stephanie O'Keefe, for those who do not know, is the National Director for Strategic Planning and Transformation in the HSE. Stephanie, please.
Thank you, Jonathan, and thank you, Laura, and welcome to the academics and researchers who are behind the work that we're discussing today, and to everybody who has joined the call. The commitment behind the EPA and the HSE partnership in generating new knowledge and evidence to improve the health of people and the environment in which they live is really testament to the fact that we just cannot separate human health and well-being from the environment, and they're just hugely interconnected. We set out on this formal partnership with the EPA in 2015, establishing the Joint Research Fund, co-hosting the annual conference that Laura spoke about, and committing to being, I suppose, responsive to opportunities to either start up or accelerate initiatives to improve human health and the environment. And I think it's fair to say that COVID-19 has really brought all of these things into stark relief for all of us on a whole load of levels. You know, whether you're looking at the causes of the pandemic, whether you're looking at the principles or the issues that are behind health protection, public health, and the environmental factors and the human factors required to protect the health of the population, whether you're looking at the criticality of green and blue spaces, as we were trying to manage during lockdown and during kind of periods of COVID restrictions, or indeed the importance of the environment and human health as it relates to the easing of those restrictions and the easing of the lockdown, which hopefully we will see more of into the future if the current restrictions are successful. And I have no doubt that, I mean, certainly with regard to the people who are interested in this particular seminar, but even more widely, that it's very easy for people to kind of touch kind of, I suppose, memories or thoughts, ideas that they have in relation to the importance of the environment and human health, particularly as a result of what we've all experienced. I know myself, even just recently, my eldest daughter, who's 14 now, is cycling to school. And in my locality where I live in Dublin, the Royal Canal Greenway has opened up between just beyond Croke Park and right into the city, into the Liffey, which has just profoundly impacted the ability of people in the local area to get into the city without having to pass an exhaust pipe from a car or from a lorry or from a bus. Highly accessible and absolutely fantastic initiative. And of course it goes beyond Drumcondra up to Phibsborough and the whole way out to Ashtown now towards the Phoenix Park. And the only thing that you really have to worry about is just maybe the kind of threat of antisocial behaviour, which is something that that everybody needs to, I suppose, manage within their own lives, within their own communities, but also another example of how you can never separate the individual, the communities within which we live, from the environment, and the importance of looking at all of the rounded factors that give rise to safe, secure, accessible and inclusive environments that help people to thrive in terms of how we live our lives and in terms of how we grow old. So this ongoing kind of collaboration with the EPA is really important to us, and I'd really like to commend and thank the researchers for the work that they're doing. I'm really interested to hear them, and particularly to our researchers in NUI Maynooth and UCD and NUIG Galway. And to thank the EPA and my own health and wellbeing staff for the ongoing collaboration. I think that it's really important. And it's really important that we're all working and in fact kind of living our lives in such a way that promotes the generation of good data, of good evidence, and indeed that tries to ensure that we're all doing the best that we can in the lives that we lead, in the work that we have, to implement policy that has a discernible, real impact on human health and the environment. Finally, from the perspective of the HSE, I would be remiss if I didn't say to people to, first of all, really enjoy the seminar, and I hope that it's really thought-provoking and sparks lots of ideas and thoughts and thinking for further things to do, but also it's really important to stay safe, to wash your hands, to be careful of cough etiquette, to do everything that you can to reduce your social contacts as we're in level 3. And to hold firm. It's a difficult time for everybody. It's not necessarily kind of equal for all either, and that's very difficult. We need to be mindful of that. But just to stay safe, and good luck to the researchers presenting for the rest of the webinar. Thank you.
Thank you very much, Stephanie. I appreciate that. And actually, on behalf of all of us, may I extend our appreciation to you and your colleagues in HSE for the work you are doing in protecting the health of all of us during this difficult time. Thank you. Okay, so we gave a challenge to our 3 research, because they are related bodies, so we gave them a challenge to try put together a short video that sort of emphasized the connectedness between the 3 research projects. So the researchers came up with and worked with our own colleagues here in EPA for a very short little introductory video that explores the connectedness between the 3 projects. And then we'll go on to hear from the individual researchers themselves. So first then, Elise, will you share this video with the group, please?
My name is Mark Scott. I'm Professor of Planning in UCD, and I'm also a Principal Investigator for the EcoHealth Project. There is an inextricable link between environmental quality and positive health outcomes. We know that environmental degradation, such as poor air quality, has negative health impacts, but less is known about the potential positive impacts of environmental goods, such as green and blue spaces, and the benefits they have for our health outcomes. In 2015, the EPA and HSE launched a joint research call to support the implementation of Healthy Ireland and to develop an evidence base on the relationships between environmental quality and health. The aims of this co-funding were to develop national capacity in this important area, to generate data to make evidence-based decisions, and also to mobilise this knowledge for the use of environmental and health protection. The call focused on examining the health benefits derived from green and blue spaces, and 3 projects were funded. Near Health, led by NUI Galway, GBI Health, led by Maynooth University, and EcoHealth, led here in UCD. Together, these projects examined the value of green and blue spaces as part of Ireland's essential health infrastructure. We sought to enhance the evidence base, identify research gaps, and develop toolkits for policymakers and local communities.
My name is Dr. Ronan Foley. I'm a lecturer in the Geography Department at Maynooth University, and what I want to do now is just give a very quick overview of the 3 projects that we were all involved in. So I was the PI on the GBI project looking at green and blue spaces and health, and the main aim of that project was to model using GIS and statistical methods the relationship between the amount of green or blue space an area had, what we call green-blue infrastructure, and a series of different health indicators. So we basically modeled the amount of green and blue in an area against health data, things like mortality, self-reported health from that area. And we found a generally positive association from those relationships, but also some important findings in terms of what types of health data are out there for one to do some statistical modelling on. The second project, the EcoHealth project, or Ecosystem Benefits of Green Space for Health, was led by Professor Mark Scott from UCD, and that project was much more around the design and planning elements of the work. So the project worked on the perspective that accessible and well-designed green spaces are essential infrastructure, so it was taking on the infrastructure idea, but looking at the specific design of green and blue spaces around how they could promote physical activity, enhance mental well-being, enhance social interaction, reduce environmental risk, and mitigate environmental risk through good design protocols. And the end point of that project was also to make some policy guidelines and policy recommendations in terms of design, so kind of create a sort of design tools. The final project, led by Katrina Carlin and her team at NUI Galway, was called Near Health, Nature and Environment to Attain and Restore Health. And that particular project was working much more on a community level, so kind of moving on from external data to design and planning down to kind of more experiential and community level activities. So they were really interested in exploring how people valued and experienced nature for health and well-being, looked at some of the bridges and barriers to nature connection. A lot of very good sustainable explorations in there about what people want for future healthy environments, and in particular developed a lot of small work around nature-based activities. So very interested in what people did in green and blue spaces and how communities work together. So the research certainly highlighted the value of investing in and planning for better access and use of biodiverse outdoor public spaces. They particularly demonstrated the role of blue and green space to enhance ecosystem and human health and resilience. I think they also, from working directly with people and co-producing knowledge with local communities in and around Galway, but well beyond Galway as well, identified solutions regarding people's values and perceptions around how nature and blue and green space worked for them. And as a final output from the project, they developed a series of how-to guides and some toolkits to allow other local authorities and other communities to benefit from the work that they developed.
I'm Katrina Carlin. I was the principal investigator with the Near Health project. 3 broad themes emerged from all the 3 research projects. Firstly, there are quantifiable health and well-being benefits from using green and blue spaces. Secondly, we know the features of these green and blue spaces, what makes them of value to people, and we also know what deters people from using them, like things like litter and neglect. And thirdly, we know that using these green and blue spaces can be integrated into a way to live more sustainably and to be more resilient. We know from what Ronan has told us already that these green and blue spaces include parks and gardens and forests and farmland and coasts and seashores. But really it's anywhere that you can get out into nature. We know that there are physical, mental, and social benefits from being out in these green and blue spaces. GBI for Health demonstrated techniques to collate, overlay, and aggregate health data. As well as providing a critical analysis on the availability of health data, they identified where there are gaps and also opportunities for future research. EcoHealth developed key design principles to maximise green spaces as health promoting environments. Near Health developed a toolkit for individuals, communities and practitioners to connect with nature and develop their levels of engagement. What this shows from all these research projects is that these places are of value, but they must be accessible to all ages and all abilities, and they must be protected and cared for in the long run. And also we need more of them because they're important for our health and well-being and also for a healthy environment.
Okay, thank you, folks. Hopefully that has whetted your appetite somewhat, and we're going to do a little bit of a deep dive now into the three elements of research. And we're going to start with the Near Health group, and there will be a kind of a three-handed presentation here from three representatives of the group involved in this. And that was Doctors Carlin, who we've just heard from, and Dr. Kinderman and Dr. Britton. So Katrina, Geisha and Iski, respectively. They're very long bios, but what is interesting is a nice mix between the sort of ecological scientists, the environmental sciences, and the social sciences in the team. And I think that is an important blend for this type of work. So with that, and they have prepared their presentation by way of a video, so we play that now, and following that then we will join Mark for his presentation. Thank you.
For joining our presentation on the Near Health project, delivered by myself, Geisha Kinderman and Iski Britton on behalf of our team. Geisha will introduce our key objectives and values. I describe participatory processes. Iski discusses nature-based activities, and I conclude by reflecting on take-home messages from all three projects and recommendations for future actions.
Humans are part of the environment, and connecting with nature has huge benefits for our physical and mental health and well-being. This means that the state of nature and the quality of the environment around us affects our health and how we live. The main aim of the Near Health project is to connect people with health-enabling blue and green outdoor spaces. We want to find out what motivates people in Ireland to engage with nature. What are the barriers preventing people from accessing nature, and, very importantly, how these can be overcome. We also want to know what different communities want from nature in terms of health and well-being, and how we can effectively connect people with nature for their health. To address these questions, we work with communities to co-create inclusive, nature-based solutions that engage people with their environment to promote and restore health and well-being, helping us value and care for a healthy environment. The overall outcome of this work is a toolkit to connect people with nature for their health and well-being. The first thing we did was to identify and interview our stakeholders. Our stakeholders were those who were engaged with attaining and restoring health, came from urban and rural areas, were associated with blue or green spaces, both those spaces, or neither. They were promoters and providers of spaces and activities, decision influencers and decision makers. They were active users or potential users of such spaces. They were health practitioners and educators. We tried to keep an even spread between genders and included stakeholders across the life course. We included an even spread of stakeholders from urban and rural environments, And we tried to include those that were not at all engaged with blue or green spaces and those that were using them at different levels, although most people were using blue and green spaces already in some way, shape or form. The first thing we asked stakeholders about were how they valued nature and what their motivations were for engaging with it. And this showed us that people already recognised that engaging with blue and green spaces has a positive impact on their mood and their well-being, as well as their physical health. It was also something that people felt should be accessible to everybody. It was something that was an essential, not just a luxury. And it was something that was important for people of all ages, not just for children. We then asked people to tell us about barriers to engaging with nature. What is it that's making it difficult for people to engage with nature? What's holding them back from doing so? And what came out of this line of questioning was that there was people's perceptions that were holding them back. People think that you cannot go outside if it's raining, or that they don't have time, or that outdoor exercise is only something for fit people. But also recognition that people have become disconnected from nature. They don't know how or where to connect with nature. And that there maybe aren't enough events to bring people out to engage them with nature as such. But very importantly, there was also the fact that litter and neglected facility is something that really turns people off from engaging with nature. And physical access in general was something that was highlighted, that there isn't enough being done for people, for example, with physical disabilities to allow them to access natural environments. We then asked stakeholders to tell us how these barriers could be overcome, what bridges there are to engaging with nature. And here on the one hand, there is a recognition of the need for education in terms of where nature is, what nature is, how you can engage with it, and what the benefits from engagement are to people's health and well-being, for example. There's a recognition of the need for community events to bring people together and to provide peer support, and also to ensure that sites are easily accessible for people of all abilities.
We then used participatory workshops to ask people what they wanted from a future healthy environment. They showed us that participatory process could increase social cohesion and connect people and organisations from across a community to create an action plan to help them achieve a healthy, resilient community and environment. Participants identified essential features of a healthy future environment. They proposed key themes or motivators for action, for example, awareness or active citizenship. And each theme links to short, medium or long-term actions to achieve a healthy future environment and promote sustainable living.
Visions of healthy futures helped us identify what experiences, activities and tools can help connect people, nature and health to benefit health and well-being. We engaged with and worked alongside various groups and community organisations across activities in both blue and green spaces and urban and rural areas, engaging at least 320 participants. Co-creating and applying multiple methods and drawing on multiple sources, including surveys, participant observation, interviews and expert workshops, helped us to review the impact, feasibility and sustainability of nature-based activities. Through this process, we identified common key features and mechanisms that support healing, restorative and health-enabling processes and outcomes, such as the creation of an emotional and physical safe space and a non-competitive and non-judgmental setting and experience. Most studies were one-day activities, with the exception of 3 long-term studies for restorative benefit, including a nature walk with Cree, sailing and surf therapy. In the following slides, we'll spotlight a snapshot from just a few of these activities and ways of connecting diverse groups with nature. Sea swimming is rapidly growing in Ireland, especially as we've observed during COVID-19, and yet it is relatively unexplored and under-researched in the context of health and well-being. In partnership with Ebb and Flow in Galway, whose organised swim programme engages adults with sea swimming for the first time, we found that this activity enhances a deeper sense of connection and positive link between emotion and exercise, with significant improvements across multiple health and well-being measures, as illustrated here. In partnership with Clean Coast, we looked at the potential impact of beach cleans on health and well-being, as well as its environmental impact. This is a highly accessible and engaging activity and has high potential to be rolled out with little to no cost. This activity also encourages an emotional connection with place and highlights the social well-being benefits of pro-environmental group activities, reducing social isolation, as well as significant improvements across multiple health and well-being indicators.
Walking is one of the most accessible activities. We collaborated with CRE, the National Institute for Preventative Cardiology, to implement this activity. Participants significantly increased their step rate over the course of the programme, bonded with each other, and developed a keen interest in nature. Partnerships involving walking groups, local heritage and community organisations could easily implement this activity in their area. Like beach cleans, bat box monitoring is a pro-environmental activity. Run with direct provision residents, the local bat group and men's shed, participants made, installed and monitored the bat boxes during day and night walks. This citizen science project instilled a sense of place, pride and purpose. Local conservation and community groups could implement similar programs to build community connectedness, protect rare wildlife and add to our citizen science knowledge base. Like sailing, it can attract people who may not readily take action for health purposes only, and so is a form of health by stealth. For more information on all activities, see our report and toolkit. Common themes emerge from these projects. GBI Health and our findings demonstrate health and well-being benefits and identify inequality aspects. How communities envisage their healthy spaces resonates with the design principles and features identified by EcoHealth. Future research should address understudied cohorts and habitats and cultural or gender influences. Green and blue spaces must be accessible and attractive for all ages and abilities. What we do has an impact on these multifunctional places. We need more cross-sectoral collaborations to design, manage, promote and monitor them from a people, planet, nature and health perspective. Let us walk along the River Corb following the footsteps of the Cree participants to see and hear some of the wildlife that enriched our walks. Thank you for listening.
Thank you very much for that, Iski, Geisha and Katrina. Very interesting results and nicely presented. So we'll hold all questions to the end and we'll hear from the three research projects first, folks. So next, what I would like to do is introduce Mark Scott from the EcoHealth project. Mark is Dean and Professor of Planning in the School of Architecture in University College Dublin. So Mark, when you're ready, please, can I invite you to speak? Thank you.
So my name is Mark Scott from UCD, and I was the principal investigator for the EcoHealth project, along with my colleagues McLennan, Owen Douglas and Craig Bullock. So if we go on to the next slide, Elise. So the basic key question of this presentation is, how can we enhance people's use of green space for health and well-being? So we've already heard this afternoon from Laura and others that at a generic level, we can see those and understand those potential health benefits of green space. It helps our physical activity. It helps with enhancing our mental health. Green space can reduce our environmental risks from pollution as well, particularly air and noise pollution. So if you go on to the next slide, Elise. From a planning perspective, conventional approaches to thinking about green space tend to focus on the quantum of green space, how much green space there is, and maybe our accessibility to it. So these are quite easy to map and measure how near green space is to residential areas, for example. However, not all green spaces are the same or have the same qualities. So you can see in these two pictures at the top is a sort of green space sort of left on the edge of a residential development, and not really being thought through. On the slide underneath is a much more active greenway, which has other qualities around biodiversity as well. So just being close to green space doesn't mean necessarily you have the same benefits if the quality of those green spaces are different. So questions around quality of green space, questions around the different types of users of green space and the attributes that might attract different users into the spaces. And that relates to that central premise of the project, was about examining the green space attributes that can promote health. So next slide, please. So the EcoHealth project was a 2-year funded project that involved multiple research methods. Conceptually, the key thing was trying to understand the idea of conversion factors. What is the attributes that brings people into green space, which then in turn brings different health benefits. So these might relate to personal conversion factors like accessibility or our own motivation. Social factors, which might be rules around park opening times, for example, or the types of activities that are encouraged or discouraged in different types of spaces. And the kind of our focus was around environmental factors, the design attributes that would encourage people to come into green spaces. So next slide. It was also important for our work that we capture different spatial contexts as well, which might require very different types of design or policy interventions. So in our study, we looked at quite a dense urban area in South Dublin around Tallaght. We then looked at a more suburban environment in Waterford. And then we also included what's sometimes neglected in green space debates. We also included a rural case study in Offaly. So next slide. So the first part of our study was undertaking a large household survey. So we interviewed 530 households, and then we undertook a further 210 choice experiment surveys as well. And the key focus was looking at the public's green space preferences and those attributes of green space that encourage people to use, particularly their local green spaces, more. So I'm not going to do a sort of a great detail on the data analysis, but I'm just going to highlight some of the key attributes that emerged from the evidence. So water features were very much a public preference, whether that's rivers, canals, coastlines. Having some sort of focal point within a green space, so a cafe or other opportunities for social interaction, proved a very strong preference. Also, we saw a shift away from kind of manicured lawns and green spaces that are quite carefully managed to a public preference for something more natural. So incorporating nature elements like we see at the bottom picture in this slide, something more like meadows, trees, and people having that nature, particularly in an urban environment, was a very strong preference. Loop trails was one of the main factors that seemed to get people into a green space, and the more loop trails there were, the more people had a preference for it. So clearly walking in, using the park for walking circuits or for running. Greenways were very popular, except with older people who maybe so often saw the conflicts with other users, so particularly didn't like maybe when cyclists came up very quickly behind them. Also, we found that when green space was able to be used as part of a commute, so Stephanie talked earlier about using new greenways to commute to school, and they were very popular. People would even go out of their way and have a longer commute if it would incorporate going through a green space. So combining green space provision with sustainable mobility seemed really important. Quietness was a key quality. So green spaces as restive places. And as Katrina's already talked about in her presentation, certainly being litter free was a really important. Litter, poor maintenance was a real barrier to people using green space. I was interested in outdoor gym equipment, which we see in lots of parks at the moment, was something that people seem to say they thought should be there, but there wasn't really much of intention to use that gym equipment. So I'm not sure if it's a really cost-effective investment. It's something people think looks healthy, but maybe it's not actually for them to use. Okay, next slide. So the next stage of the research was to take that quantitative data and to test it in these qualitative interactive design workshops with local citizens in our different case study areas. So the idea was to test the different attributes that emerged from the quantitative study and apply it in the context of an individual's lived experience within the green spaces they are familiar with. So the green spaces involved ranking different green space attributes. And if we go on to the next slide, please. You can see that we worked with these different aerial photographs, different designs and redesigns of existing green spaces, and would work through the various elements to see which aspects of green space provision had the strongest preference among local citizens. Next slide, please. So I'm just going to run through very quickly some of the key findings from those design-based workshops. In relation to the rural case study, it wasn't so much that locals were demanding new green spaces, but they argued very much that existing green spaces needed to be used better. So sometimes it's about retrofitting existing green spaces. So better green spaces, not more. Using the existing linear features, the existing rural places, so like river corridors or perhaps disused rail lines, and these seem to be most suitable for a rural context. The key thing to emerge was people looking for linkages between green spaces and also between green spaces and where they lived. So much more segregated walkways, maybe cycling opportunities that link all the local green amenities in a particular area. In the suburban context that we looked at, some of the green space had been quite poorly designed, and that had attracted in itself some antisocial behaviour. So priority in the suburban context that we looked at was about providing much more social interaction in the green space and using green spaces for community building. So here the emphasis was actually on multifunctional uses of green space. So not just playing pitches, not just a playground, but spaces that would encourage different multiple uses and therefore attract different groups in at the same time. So one idea was maybe intergenerational contact could be increased. That would increase informal surveillance in an area. So for example, in the middle picture here is a community garden in an existing park. And this brings different types of users into the park at different times of the day. Finally, in the much more dense urban context, green spaces took on a different form. So the idea of green spaces as an urban refuge, providing a space of relaxation, seemed to be the most important quality that people were seeking. So green spaces here would be almost destinations themselves as people sought some sort of relaxation and social interaction. Part of this was the wider environment was very car dominated. So there was an idea of maybe greening the wider public realm that would link into the parks. So if we go on to the next slide, I'm just going to finish off today with a few slides that look at trying to draw on the evidence to develop some design principles and to look at some implications for policy making. So I guess one of the core principles that emerged initially from the study was the idea of accessible green spaces and their importance. So this wasn't simply about proximity, but it was about the linkages to other green spaces and the linkages in particular to residential areas. And those linkages should be things like circulated pathways or cycle lanes that link in with local parks. So the emphasis in design emerging from this was very much a networked approach. Rather than thinking about individual green spaces or parks, it was emphasizing a green infrastructure network that would create a network between different green spaces, parks, canal walkways, and so on, and connecting those and connecting urban and rural places as well. So greenways, linear parks, linking local greenways with more regional and national greenways, or opening up watercourses for river walks. You can see the example here in this slide is from Naas Road local area plan in Dublin, and just looks at trying to connect different parks, green corridors with footpaths, cycleways, and new walks. Inclusivity in design is absolutely crucial. So catering for diverse local users is important. I think sometimes our parks tend to privilege people who play sport or organise sport, but trying to look at green spaces that cater for all age groups, all physical abilities. So an idea that's emerging from the United States is the idea of 880 parks. If it caters for an 8-year-old and an 80-year-old, then it's fairly inclusive in its design. If we move on to the next slide, again, making connections with what Near Health found, this idea of well-maintained green spaces was absolutely crucial. Once a space becomes associated with vandalism or antisocial behaviour, it acts as a major barrier to people using that space. I keep on coming back to the theme of multifunctional green spaces, and I think it's absolutely key that green spaces serve more than one group or one type of activity in it. And the green spaces are designed with co-benefits in mind. So a green space like the bottom scheme in the sketch is not just an effective and attractive green space, but it plays a role in managing local flood risk as well, and also enhancing local biodiversity. Right down to the fine grain of planting strategies is also important. Through effective investment in planting strategies, we can mitigate noise and air pollution, particularly in urban contexts. And that relates also to creating multi-sensory environments or restorative environments that really increase our contact with nature and provide restive places. If we move on to the final slide, just to reflect a little bit on the wider policy support, I think for me, and it's something I think resonates with everybody after COVID-19 lockdowns, was the idea that our green space is also part of the essential public health infrastructure of the nation, and investing in that isn't really an optional extra. So we need to value green space for the services and functions they provide, and to think of things like vacant land, not just as land awaiting development, but think of the other green space functions that they serve. Secondly, there's an opportunity to integrate health promotion with green space management. We saw lots of examples of the great work that Healthy Cities and Counties networks and different groups there are engaged with, and trying to maybe think about how we brand or market our green spaces as health promoting environments, as ways of getting people into them to encourage the use. So things like park runs have been really successful in that regard. From a planning policy perspective, certainly mainstreaming health into environmental assessment and mainstreaming health into planning goals is absolutely critical. So the green infrastructure approach that has been very common in planning strategies of late is something that needs to be advanced further, creating networked and multi-scalar green networks throughout Ireland. And here I would argue that we need to retrofit lots of our green spaces as well. Planning, I think, should be about making better places, and too much recently we've been about simply about focused on housing delivery. But we should be thinking about the health outcomes of the places we're creating, and try to create certainly more health promoting environments in our urban and rural environments. Echoing again what Near Health said, co-designing green space with end users, local participation in getting people's local values and preferences into green space design. And finally, there's a recognition that we need to build capacity. Certainly in the austerity years following the economic crash, some of the investment in parks across Ireland certainly declined, and certainly the capacity at local level in terms of like park management declined as well. So involving in that human resource element, improving the capacity and design skills of planners, landscape architects, I think is critical to advancing these debates. So apologies for the technical problems, but thanks for the listening today.
Thank you very much, Mark. I appreciate that. I like the simple elegance of the 880 concept. That's kind of interesting. Just to remind everyone, if you have questions for Katrina, Iski and Geshe, and Mark, and indeed Ronan, you can populate the meeting chat with your questions now, and I'll pick those up at the end. Thank you. So can I invite our second last speaker, should I say, for this afternoon, Ronan Foley, Associate Professor of Health Geography at Maynooth University. Ronan, thank you.
Thanks, Jonathan. Let's see if I can get this thing on the road. So I'm just going to go through this quickly. So our project was a one-year desk study of the associations between access to green and blue infrastructure and health indicators in Ireland, measured at a range of different scale and for a range of different health indicators. So it was an ecological study, kind of a kind of back-end study, if you like, compared to the other two. And I've also listed our partners there. Dunstan Arodju was our postdoctoral fellow. Gerald Mills and Tina Ningle from UCD were involved, as were Michael Brennan and Malky Bradley from the EMRA. So I'm not going to go through this very complex looking socio-ecological framework for the relationship between green space and health, but I want to just pick on, essentially, we were looking at the two end pieces, the kind of access side, the exposure side, in a very ecological way, and a series of different kind of health outcomes also measured ecologically at the other end. So in a way, one might see this as a useful diagram to bring in some of the work that NEAR and EcoHealth did. So they were kind of doing some of the work in the middle, and I think collectively we were maybe talking to that very broad framework. So the aim and objective, the aims and objectives of the project was to establish associations measured at different geographical area scales between the amount of green-blue infrastructure, the amount of green space and the amount of blue space, and seeing those, if you like, as a proxy for exposure, and selected health indicators as outcomes for those same areas. We used GIS, geospatial data, and let the health data drive the modelling, hence a reference in our reports to the idea of a health-led spatial modelling. So we were as interested, if you like, in the health data side as we were in the green-blue infrastructure side. Where possible, we compared data for different time periods between 2006 and 2016. It wasn't always possible to completely align those, but we wanted to bring in a temporal element. And the different health indicators we used included measures of mortality, self-reported health, limiting long-term conditions, and deprivation. So deprivation was more of a proxy indicator. And the GBI measures used include both combined proportion in terms of size, in terms of hectares of individual green and blue areas, calculated as percentage of the land cover in each of the aerial units that we actually modelled. So in terms of the materials we used and where we kind of gathered the data from the study, we focused very much in terms of the health data on measurable health data gathered from publicly available sources, including the census, the Department of Health data, some HSE reporting, and also in particular some local work we carried out in Maynooth that modelled mortality at an intermediate scale of detail. The GBI material was drawn from a series of standardised EU land cover datasets such as Careen and Urban Atlas, though there is good ongoing work developing sharper and more refined sets of data to provide that information. So all of the spatial data was fed in as layers into a GIS and overlaid and modelled to generate both statistical and visual output. There was a considerable amount of GIS processing required to build the data sets, and anyone who's worked with aggregating health data from different scales knows that can be a tricky process. And we were partially successful in terms of this, in providing a mix of good data across different timescales at different scales. So just want to very briefly show an example of some of the data sets we were working with, some of the dates. I'm not going to go through these in detail, but you have the type of data scale we were working at. So we tried to work at meaningful geographical scales of analysis like ED and intermediate area level. We got dates, we got specific sub-variables within there that we incorporated into our model, and also we kind of classified them in terms of whether they were measured data, self-reported, or derived or proxy. I think that clarity of the kind of, I suppose, a measure of data provenance is probably quite important in there. In terms of the actual examples of some of the ways in which we visualize the data, these are just some representative maps that we incorporated into our modeling, just to give people a sense of kind of what's out there in terms of detailed data. On the left image, you have self-reported good health. Irish people are remarkably optimistic about their health compared to other countries. In the middle, you have self-reported poor, bad, or very bad health from the census at small area levels. So this level of geography is actually neighbourhood scale or estate level geographies. And again, while there were some difficulties with modelling that against the green and blue infrastructure, we think it's a really fine-grained geography to begin to work with. And then finally, I just showed you a little example on the right-hand side where we actually, this is where some of the health-led components were fed into the spatial modelling. We looked at clusters of this data. So it wasn't just about mapping the data, it was doing a bit of statistical analysis to identify clusters of areas with similar health outcomes and then incorporating those into the modelling that we carried out. So this map here is just showing you some of the geographical detail and geographical scale of the GBI infrastructure maps that we used. The Korean data is 30 meter accuracy, the urban land use is 2.5 meter accuracy, and obviously the more accurate that is, the finer tuned your modelling can actually be. So broadly speaking, I'm not going to present any detailed statistical results here, but we identified broadly positive associations between the amount of green and blue infrastructure as a proxy for access and individual health indicators. Simply put, the more green or blue infrastructure an area had, the better the measured health indicators were for those areas. And while the strength of the relationship varied, it was consistent across scales and for most of the indicators, especially mortality and self-reported health. When modelled individually, positive associations were clearer for green over blue space, but we think that the better quality and mapping of the former was one of the reasons for that. There were some more confusing results when modelling deprivation, and these are a little bit trickier to model given the methods we were actually using. So just in terms, I suppose, of a set of broad findings and recommendations, in essentially this project was a proof of concept that showing that it is possible to measure ecological area-based associations at different scales between different health indicators and good GBI availability. The scale of analysis matters as well, and while there are a number of complexities associated, we think that one of the issues in terms of health mapping work in Ireland and health data work in Ireland is the lack of a good intermediate reporting geography. County level is too crude, small area level is far too detailed, and even ED level can be almost too detailed. So one of our recommendations or findings was in terms of the data audit side was to think about reporting geographies. I give you one very quick example. If you think about some of the recent COVID reporting, people have been reporting that COVID data at local electoral area level, which is sub-county. It actually has a political oomph because that's where your local councillors come from, but actually it gives a good spatial nuance. And then there are a number of other potential scales, such as primary care networks, for example, that could be very useful in that regard. We also suggest maybe thinking a little bit more about how one starts to gather spatial data that's health related, and working perhaps a little bit more with health administrative data collected by the HSE and Department of Health. Think a little bit more about how you can use quite detailed geographical information almost at the individual level, but scale that up and aggregate it in meaningful ways. And I guess the AIR code is also a good tool to do that. So again, a number of other issues around comparability, timing, detail, etc. And then just, I suppose, to link back up to the other projects to finish off, we confirmed associations in this project at an ecological scale between accessibility measured as availability of green and blue infrastructure and good positive health outcomes. I think we link to the eco-health work. We could maybe do some more detailed place-based exploration and provide a better insight perhaps into how GBI has value in specific locations. And again, we could maybe bring in a bit more rural modelling work in there. I think we also thinking about it at an ecological scale also deepens our understanding of how people extract health from green and blue spaces, and then the Near Health project told us a lot more about how people use and move in them. And I think also because I know that the SRI project, we're doing working with the TILDA data, so there's some really interesting potential for some circular learning from cross-sectional and longitudinal work linking back to ecological modelling that would improve the quality and level of that analysis. So I think that's me done. Thank you.
Thank you very much, Ronan. That was really very interesting and prompts loads of questions already, and how it all connects with the previous two projects. Thank you very much. So we move then quickly on to our last speaker this afternoon, Gianluca Gurilli from the Economic and Social Research Institute. He's an economist, but I'm led to believe that his surname Grilli means cricket, the zoological, not the oval players who play in white, but he's a cricket. So I think it was only natural that he would migrate as an economist to environmental matters with a surname like that. Well, Gianni, that's probably the most interesting bio you have ever had read of yourself. So I now invite you to present your results. Thank you.
Thank you, Jonathan, for introducing me. Yes, as you said, probably that was a premonition of my future profession then. So this is my shared screen, I think.
Yes, we can see that, Gianni. Yeah. Can you put it to press? Excellent. Yes, we're good.
Okay. So this is my presentation, which is a piece of work that I did with my co-author Greta Mohan and John Curtis, both from the ESRI a couple of years ago, and within the joint research framework ESRI and EPA. And this work was mainly related to the association that exists between the visit to public parks and the health status. So in a way, some of the findings are similar to what has been said before. But this is just part of a larger project, of a larger agreement between the ESRI and the EPA. And for what I will be presenting today, the main takeaway is this. So visit park twice per week to be healthier. Because what we found is that when people visit twice per week a public park, then it's likely that the person is going to have good health outcomes. Why and how we reached this conclusion? It's basically because, as other people pointed out before me, as it is well known, there are a few benefits of green spaces within the cities, which are partly related to individual health. And in fact, it has been shown that green spaces have a positive impact on mental health, on obesity reduction, life satisfaction, stress reduction. They also have positive impacts on the environment, for example, in terms of air quality, illness prevention, and also physical activity. So with that in mind, we try to understand whether there is in Ireland a positive association between the visit to green spaces and individual health. So do people that visit green spaces are healthier compared to others in Ireland? This is the question that we try to address with this piece of work. And how we did that? Basically, we set up a statistical model in which we try to understand what's the causal relationship, more or less, between the visit to park and some health indicators. Visit to park was collected in simply as a variable that captures the number of visits of the respondents in the past 4 weeks. And then we had 3 health indicators. So we try to understand what's the impact of these park visitations on self-reported health, on mental well-being, and on cardiovascular health. We collected the data through a questionnaire survey that was administered to a sample of Irish citizens, and the sample was stratified by age, gender, location in Ireland. We concentrated only on major cities because, of course, if you're in the countryside, you don't really need to have a green space to use. You have a natural environment surrounding, so it's probably redundant to have a green space. And the questionnaire was very general. So we collected some information about the green space use and the attitudes toward visiting green spaces, a section that it's not treated here for the sake of time mostly, which is preferences for the attributes of the green space. And this is partly related to what Mark presented before. We also collected information on leisure time and physical activity, health and well-being, and sociodemographics. And in particular, the way we collected the indicator variables that were the variables that were most important in this study were these 3. So self-related health. How would you describe your health status on a scale from 1 to 5? Mental well-being was an indicator that was created as a combination of different questions. So how much of the time during the past 4 weeks have you felt one of the following? So anxious, downhearted, calm, full of energy, or happy. And the combination of the answer created a synthetic indicators of mental well-being, and then cardiovascular health as having experienced high blood pressure, heart attack, or a stroke. So we set up the statistical model in which these were the response variable, and the most interesting independent variable was the number of visits in the past 4 weeks to green space. And we tested two models here, a linear relationship and a log linear relationship. Basically, in this slide, don't want to get bored with statistics, but basically here the numbers, the positive numbers says that the association is positive. So as the number of visits to green space increases, then it's more likely that people experience good positive health. These are two competing models basically, and we in the report and in a paper that was published following this study, we think that a log linear relationship describes better what's happening between the green space visitation and the outcomes. Because a linear relationship basically means that you can indefinitely increase your health just simply visiting the park. So if you visit an infinite number of times, then you will have a perfectly fine health, which is probably not really realistic. Whereas a log linear relationship tells you that there is an upper threshold. So you can increase a bit your health visiting green space, but up to a maximum, not indefinitely. And this more or less is the marginal effect of visitation, which basically tells you this. So a log linear relationship between the number of green spaces, which is here in the x-axis, and outcomes that is in the y-axis, is log linear in the sense that you can increase at decreasing rate your health as you visit more often, but this would be up to a maximum threshold. What is interesting to note, and what I presented before in the first slide, is the actual probability of being healthy following this study. So if you visit green spaces just once every 4 weeks, these are the probability of being healthy. So you will have 87% probability of being of having a self-rated general health, good health, 69% of having good mental well-being, 91% probability of having good cardiovascular health. If you increase your number of visits every 4 weeks from 1 to 8, which means exactly twice per week, you will have a good increment of health, at least according to these indicators. So your probability of having good self-reported health increased from 87% to 90%. You will have a big increase in your expected mental well-being from 69% to 76%, and a good increase in your cardiovascular health from 91% to 95%. If you visit more than the green spaces, and you visit 15 times, which is roughly 1 every second day, you will still have some increase in your health indicators, but the rate is much lower. So you can see in this last column that you will have a larger probability of being healthy, but not too much different compared to the others. So just 1 percentage point higher for self-rated general health, 2 percentage points for mental well-being, and roughly similar cardiovascular health. So basically, if you visit twice per week, it's, according to this study, it's enough to experience a good increase in your health, assuming that you are at the moment visiting less often. So as I said, visiting twice per week, it's good for your health. The association between visitation to green spaces and health is positive and statistically significant. Health benefit is probably The log model, the log linear model, tells you that probably this relationship is up to a certain threshold, so the decreasing rate as you visit more often, and you will have the largest improvement on mental well-being. So when you visit twice per week, the largest improvement that we've seen here is associated with the mental well-being. So this study, it's probably a justification of the policies that attempt to foster the use of green spaces within cities and the investment towards it. And thank you for your attention.
Thank you very much, Gianluca. Appreciate that. Folks, well, we'll see how we got on time-wise for our questions. Lots of questions flying in there, and I appreciate everyone making the effort. I'm going to try kick off a few. Some of the questions that I'm seeing relate to this kind of antisocial behavior aspect, and maybe to, whether it's Ronan or Geisha, Iski, Katrina, to take this really, what strategies of antisocial behavior, a kind of management of that risk and that concern have been effective. And this, one of the questions also said, the smoking, clearly, smoking in these public places is upsetting people, and is that within scope of what would be considered an antisocial behavior in your views? I'll start perhaps with Mark to take that, and then maybe our colleagues from Galway might like to comment.
Thanks. I think antisocial behavior, perception of it, sometimes it's not always right. Sometimes when people see a group of young kids hanging out, that seems antisocial, but it is just young people using the green spaces as well. So we do need to be careful how we frame some antisocial debates. But certainly, when green space is poorly maintained, when there's litter or it has an appearance of neglect, it acts as a barrier for people using it. And sometimes that reflects maybe local authority budgets in relation to maintaining green spaces. Parks departments have been reduced quite considerably, and hasn't really built up again. But also some of those green spaces that exist on the edge of housing neighborhoods, they sort of feel like nobody owns them, and they become sort of very quickly sort of no man's land, and it's not quite public space, not quite private space, and it tends to be underused. So the more people are using the space, it adds natural surveillance. If it's well designed, people are overlooking it. It acts to create a sort of environment that feels safe to use as well.
Thank you, Mark. Colleagues in Galway, anyone like to comment on that sort of concept of what are successful strategies for antisocial behaviour, and this idea of whether smoking comes into that or not?
Sure, I'm happy to take that on, Jonathan. And I think I can really just agree with what Mark has said, that it is, once we make spaces accessible, once we make sure that there's well-maintained facilities and there's a mixture of people using them, then there's a reduction of what's perceived as antisocial behaviour. Also often that feeling of places being opened, so not, like being behind walls, that sort of thing, where people feel that they're sheltered, they can hide behind things. That helps as well, is that, you create spaces that are inviting and that everybody's happy to use, and that are not felt as even threatening spaces. But even things such as lighting make a difference in public spaces, for example. But it is definitely about building up that natural surveillance that Mark mentioned, by allowing a lot of different people into these spaces and letting them use them.
Thank you very much, Geisha. Javier Vila, I'm looking at your question there on the looking at rural areas. In fact, there was a piece of work that ESRI did, published a couple of years ago, and they particularly looked at the attributes and access to green blue spaces that included more rural areas around the metropolitan fringe in Dublin. So there is some interesting work published there, and it's in the it's published on the EPA website to the ESRI EPA Phase 1 work, and I would imagine it's referenced in Gianluca's work as well. So let me see, what else do we have? Now, someone had an interesting question, and Ronan, you might have a view on this, or indeed Mark as well. They were talking about these faux green, and blue spaces. I suppose these could be micro spaces that might have an urban area where you're trying to, either in a hospital compound or in a workplace or other kind of micro places. I think Anna Davies had a very interesting expression for these called meanwhile places. I think, when one can't decide what to do with a piece of ground, you do something creative with it. But these faux green and blue spaces, do they, in your view, do they add value?
Well, I do, and I think that's part of the difficulty sometimes with classifying an area as green or blue. I've personally written elsewhere on the idea of palettes of place, that actually, nothing is ever pure green or pure blue, and the sea, as an obvious example of a blue space, has multiple shades, and that idea of a palette of places that people use, they're outdoor spaces. They're not always necessarily pristine green or pristine blue. They're grey, they're yellow, they're white, they can be. So there's quite a bit of literature in health geography certainly around different palettes of place. So that idea, and then the other person who's really worth reading around some of this work is a guy called Cameron Duff from Australia, who does a lot of work with young people in mental health, talking about how people produce their own health enabling spaces in these unlikely settings, so a corner of a road where a kid likes to do handstands, it's very micro level stuff, but it matters because people find any sort of outdoor space, particularly in an environment where accessing anything is difficult. And thinking of council blocks or, close city living, like accessing healthy blue space or green space of any sort is it comes in different shades, I suppose is what I'm saying, and there is some research on that.
Yeah, and Ronan or Mark and our Galway colleagues, have you any thoughts on that, on these kind of microspaces and their role? Did it come up in your work?
Yeah, I think in an urban context, sitting in an office and being able to see a tree where there's birds, whatever, even that sort of little incidents of nature and having sort of more bringing nature into a city can have very positive benefits. And certainly there's a big movement, again, based in the US, of biophilic cities that has that sort of just that increased contact with nature has sort of positive health and well-being impacts. But I think if you think about a wider urban greening strategy, I think it's important to think of these. I don't like the idea of they're leftover spaces. They should be designed into the urban fabric in the first place, and they can provide lots of benefits around local biodiversity, little rested places when you're eating your lunch, and little micro parks. And I've been really positive around COVID when I see people taking over spaces or taking parts. Near where I live, a parking bay has been turned into a micro park. And I think that's fantastic that people are sort of taking ownership of those spaces and turning them into little community gardens and things like that. So anything that sort of increases our contact with nature, social interaction, or brings biodiversity into the city, I think it can't be harmful.
Okay, thank you very much, Geisha or Katrina or Iski. Do you have anything to add to that? No, you're okay. Now there was a question in from Ian Murnan, and I suppose really Ronan it probably goes towards you. Were there socioeconomic indicators in some of your research? I mean, there is a big concern around Europe that there are these environmental inequalities, that environmental and health outcomes are certainly less well defined in areas of socioeconomic challenge. But in your work, was there any strong association between lack or access to green blue spaces and socioeconomics?
Yeah, I mean, broadly speaking, we would have noticed a general lower level of green and blue infrastructure availability in more deprived areas, certainly. As again, it depends really on what scale you're measuring that at. And one of the difficulties with modeling that geographically is that deprivation scores, for example, work really well at small area level, but when you scale them up, you lose a lot of that nuance, so actually, but the modeling works better at that higher scale. So there's a kind of a statistical reason sometimes why that's harder to pin out at ecological level. But certainly there's lots of evidence around the world that under that broad environmental justice banner, that poor environments often are poor places as well, and there's plenty of evidence on that, and I think some of that certainly could be explored more fully. Yeah.
Geisha, I think you said you had a comment here that you were able to respond to that too.
Absolutely, yeah. And again, obviously I can only echo what Ronan says. What he says is absolutely something I would agree with. But we've done some research as well ourselves and looking at our participants, for example, and there's definitely great inequality in access to blue and green spaces for people. And we see this across Ireland, and we see this with our participants in terms of how far, for example, they would have had to travel. And one of the things that I think is coming up in the chat as well, and that needs to be looked at, is that difference between urban and rural, because we really found that there's issues between people who live in urban areas and rural areas as to how easy it is for them to access blue and green spaces, with people in rural areas often being surrounded by blue and green spaces, but then these spaces are not necessarily accessible because they're private spaces. This is private land, this is agricultural land, and it's not accessible to them. So we need to look at how we can improve access there, because we did find that often people from rural areas would have to travel much further to find accessible spaces for them, which is a huge issue that we've found and that people have noted in a number of different pieces of research on Ireland. So I think that's something to keep in mind, and I think that reflects very much what's been in the side of the chat here as well, that I'm keeping an eye on. The other thing I wanted to just come back to, Jonathan, I forgot to say this earlier, when we talk about antisocial behaviour and making spaces accessible, we would have looked at the kind of pro-environmental actions as well, such as, for example, your litter picks with Clean Coasts, and that gives people, organising those kind of events gives people ownership of an area as well, and it really helps when you're looking at the maintaining of areas, and again giving people that feeling of it is theirs, it is an area that they can access, and them giving them a pride of place as well, which again helps when we're looking at antisocial behaviour, for example, and accessibility.
Very good, thank you very much, Geisha. Gianluca, ESRI did some work a couple of years ago, and they certainly where one might assume in the countryside you'd be surrounded by green-blue spaces, but I mean, as Geisha said, this access is not there because there was no footpaths and whatever, and this was supported by the work of your colleagues in ESRI. But in your work on the health dividend, was there a socioeconomic aspect in the analysis you brought to it?
So, well, that's a good point, actually, because accessibility might be an issue even in small countries. We focused on cities, but actually I think that we sampled people living in towns up to 5,000 inhabitants. So actually I said cities, but in fact let's say that we used like urban areas broadly. That it could be an option to compare or increase the data set with people living in the countryside as well. Yes, that could be interesting. Yeah.
Okay. Yeah, thank you, Gianluca. So I'm looking down here from other questions now. Roger Street had some interesting comments there, and do any of you want to respond to Roger?
I think that was a really interesting question earlier. I think it was Roger's earlier question around the implications of some of this for healthcare service provision, and maybe that statement that Mark had, that this needs to be part of a public health infrastructure. I completely understand it's a tricky question, and also that people, I don't want that to appear like a bit of pressure on someone to incorporate it in, but I think all of us agree it's more a sense of an awareness of this idea of a health enabling resource, and that it becomes part of an assemblage of services, and that services are never necessarily just a hospital bed or a GP or a needle. There are a number of other things that feed into a wider public health model as well. So okay. I'm not sure I can say anything more coherent than that. But
that sounded perfectly coherent to me. Yeah. Katrina, you had your hand up there.
I had. Thanks a million, Jonathan. So it's about planning for these spaces at the very early concept design phase, but also thinking about how we can retrofit our spaces to include them in our daily communities, and also just going back to the kind of antisocial aspect. If you think about going out to survey for bats, you're doing it at night time, and lots of people are often scared to go out into the dark. And in particular, woodland might seem even more off-putting. But by doing it with a group of people safely, obviously, there are so COVID-19 restrictions at the moment, but in general, that is a way to connect with people and to develop a greater connection with nature, but also it gives you a sense of pride and a purpose. Lots of the people who helped out with that were direct provision residents, and it connected them to place. So it's really important. These are ways that we can overcome antisocial behaviour by making these places more used at all times of the day.
Thank you very much, Katrina. Interesting question there. This is Blahing, having a laugh, I think is your handle, Blahing. I don't know what it is. Blahing, but it's a good question, and it's, I mean, are there plans to integrate kind of the findings from this into kind of green prescriptions? If there's anyone from the medical side, maybe, or Stephanie Kenny or others, who would, how do we take these sort of findings and implement them in recovery plans for people? Any thoughts on that from the panel or anyone else? No, it's a tough one. Okay.
I think just to Jonathan answer that, I mean, there is now an emerging and a very good network of healthy cities and counties in Ireland. And most of those people who work in those healthy cities or counties organisations come from a health promotion background. And I think they've been doing some really good work trying to integrate health into the very local scale of planning the built environment, the natural environment, and connecting and mainstreaming health into environment, I think is a key goal. And if you look at Healthy Ireland as a document, it's about the importance of health in all policies, and not just leaving health and the health of the nation just to the HSE, but it should be mainstreamed to all public policies. And the environment's got such a critical role to play within that.
Very good, thank you. And Taig O'Mahony, my colleague, was on the line earlier on. I hope he's still there, because I'm going to kind of pull him into it a little bit. But Taig, who works in our strategic environmental assessment, kind of looking at all the national plans and programs. But Taig, I mean, how do you see this sort of research finding its way into planning policy?
First of all, I think each of the three speakers, I think they're very relevant to land use planning and planning policies. And in terms of a way of getting the outputs and the toolkits being practiced, in practice, for want of a better word, is, I think, having some pilots at a regional, at a county, and at a local level, whereby you can have a form of tiering and a hierarchy, where higher principles coming down then to the local ditches, woodlands, rivers, streams. And I think there's huge scope for the piloting. And in fairness to some local authorities, they have green infrastructure strategies already in place, which include both green and blue. And I think it's a case of applying it more widely. And the regional assemblies, I think, have a huge role to play in this, in implementation and in driving good practice. But definitely, I think piloting and follow through on those pilots in a number of local authorities and regional assemblies. Thanks, Jonathan.
Okay.
Good suggestion, yeah.
Thank you, Taig.
Yeah, that's great idea.
I'm just looking at time here now. If there's any other remaining questions, the social prescribing, yes, we dealt a little bit with that. Okay, I'm conscious of time now. There's a GP here now. What was that? I'm in meeting to promote a new work. So there's Andre Rochford, is a GP, and he's a meeting later on today to promote a new working group on promoting healthy lifestyles as a means to prevent chronic disease. So this seems to be right up your street, Andre, this type of work where there is now, clear evidence of the outcome from this, Very good. Folks, sorry,
can I just step in there?
Geisha, you have your hand up, yeah?
Yeah, just for Andre in particular, Andre, take a look at our toolkit, because again, we did work with people who looked at cardiovascular health and how to improve it. And you might find that the toolkit's quite useful in how to engage relevant stakeholders and participants in those kind of activities. So that might be useful for you, but also for others. Again, the idea is there that this toolkit is used and that people can actually apply it with groups. And that should also work for local authorities. Sorry.
No, don't be sorry. That's just perfect. Yeah, Ronan.
Yeah. Just again, I think that working relation with health professionals is really important. You need that engagement with GPs. You need, even if you were doing kind of local level data collection, maybe work with a couple of individual GPs and do a practice-based bit of spatial modeling or a practice-based bit of health psychology monitoring or whatever. But I think that connection really is potentially very valuable on the primary health side. Yeah.
Thank you, Ronan. I'm conscious that we're just slightly over time, so maybe I'll invite our. Do you have any closing thoughts from our speakers? Gianluca, have you any thoughts or comments to finish up? Takeaways, as our American colleagues might call it.
Well, not really. I've seen a question about the international comparison of our piece of research with the others that I might
that's
just
me.
briefly answer. Okay, Aaron.
we can talk. We can exchange.
Yeah. Sure, definitely.
Okay. Thank you very much, Katrina. Any kind of takeaways?
I think the big thing is to think about how we can make these spaces more connected to communities and places, and absolutely echo what Mark said, that they need to be thought of in advance and not as an afterthought. These spaces matter to everybody and we need more of them.
Yeah, thank you very much. Yeah, Mark?
I just think at this time we know how much our health means to us, so let's invest in healthy places and a healthy environment.
Thank you, Mark. And Ronan, last word to you then.
Just say that, these projects were carried out over a 3-year period, but they were all remarkably prescient given the global pandemic we're going under at the moment. It's not as if we were predicting it, but, they are resources that I think feed into the contemporary world. And I think that bigger idea of green and blue space as spaces of respite and spaces of repair are really important in terms of mental health and well-being, and beginning to see them in that way is kind of an interesting way of, at both an individual and a community level, I think is really important.
Thank you very much, Ronan. So listen, it's the first time I've worn a tie, I think, since March. So it's a whole new world, our new world. So I'd like to thank, on behalf of all of the attendees here today, to thank Geisha, Katrina, Easkey, Ronan and Mark and Gianluca for their excellent contributions. And again, my appreciation to the HSE for co-funding this research. And I'd also like a call out for Elise, working tirelessly with her colleagues, Naomi and Amy in the background, making sure everything works for Aileen, sorry, not Amy, Aileen, making sure everything works for all of us here today. So thank you all. I've sent around the agenda, by the way, for those of you who might be interested, for the HSE EPA ASRI Health Conference, the annual health conference, which takes place in November. So that's there in the chat if you wanted to download that. The registration will not be open, I think, for another week or so, but feel free to circulate it to your colleagues or your students or anyone else. In this virtual world, I don't have to feed you all, so we don't really care how many come. So you're all welcome to tune in. And so please do circulate it to your student bodies as well. Listen, take care, everyone. Elise and colleagues will follow up with links for the recordings in case you want to use these for educational purposes. Take good care and stay safe, as they say.